Hello, this is Amanda Brummett with the Working Well in Capel Committee of the Coppell Chamber of Commerce. I'm here today with Dr. Farhana Kazi. She is a cardiologist in Coppell, and she is here to share with us a little bit about how her practice is working well in Coppell. Thanks for being here, Dr. Kazi.
Thank you, Amanda. Thanks for inviting me to this meeting and giving me an opportunity to talk to you and educate the community.
Yeah, absolutely. Well, I wanted to talk specifically about some things related to coronavirus and just for our viewers so they know, as a cardiologist, Dr. Kazi is fully trained to take care of everything related to the heart. That also means she's a fully trained internist. So we're going to cover things today more related to heart disease, but her scope is very wide when it comes to medicine in general. So I'll start with Dr. Kazi. What are some specific things that people with heart disease should be cognizant of related to coronavirus?
So, as the data has come out from China and then all over the world, in the United States, we know now the risk factors for coronavirus, well, not for coronavirus, but for people at high risk for death and significant illness from coronavirus. Number one is age. We know that people greater than 65, patient with heart disease, and they don't specify the heart disease, but anybody with congestive heart failure, bad arrhythmias, major heart attacks, bypass surgery, those kind of heart diseases are at high risk. Hypertension is coming out to be a high risk also, diabetes, immunocompromised patients, chronic medical conditions, things like that. So our patients with heart disease have a lot of those factors and are on multiple medications. Typically, even if they don't have a heart attack or heart failure, they're diabetic or hypertensive. So I would say pretty much all my patients are at high risk. So I get a lot of calls, and of course, a lot of people who have like annual visits or every 6 months are still wanting to come in or do televisit to see, to discuss their risk and what else they can do to mitigate that. So that's a concern. So of course, heart disease is a big risk factor. The other thing that's kind of that not related to heart disease, but the other thing that a lot of my patients are on is blood pressure medications, including angiotensin converting enzyme inhibitors like lisinopril, enalapril, and angiotensin receptor blockers like valsartan, losartan, very commonly used medications. So there's a lot of mixed data coming out from Europe that people on those medications are at high risk, and a lot of media, social media stuff, and newspaper and false information. So a lot of phone calls were coming about discontinuing those medications or switching to other medicines. And now American Heart and American College of Cardiology and now European Society are publishing data, which is just observation that these medications do not increase the risk, and we should not be changing them or stopping them. In fact, stopping them may even increase the patient's risk because the blood pressure gets uncontrolled or whatever the heart condition is being given for gets uncontrolled. That's something I'm dealing with almost on a daily basis. People call like, hey, I'm on this. What do you think? Should I take it? I was like, yeah. So, that kind of reassurance is needed, and something that's kind of in the media that's really bothering people.
Yeah, I love that you can help your patients weigh out those risks and really talk through that. And it sounds like your patients have really good access to you. I think I shared before, I'm hearing from a lot of doctors, patients aren't calling and aren't coming in, and it sounds like yours really are very engaged with you, which I love.
Yes. We
try that. Another thing that we're hearing a lot about is anxiety and depression related to the pandemic, which clearly is not good for our overall health, but our heart disease and that as well. So how does it specifically affect your patients that have cardiac issues?
Yeah. So mental health, behavioral health issues are part and parcel of every society, including this society. And now, previously we used to think that mental health is, you're crazy. There's really not a true thing. But data is coming out. There's so much research and supporting that mental well-being is part of just physical well-being. And I'm a true supporter of that in my own practice as well as in my lifestyle, my daily life. I try to promote mental health and well-being. And with this COVID situation, everybody's kind of going a little bit crazy because if you're not working, if you're unemployed, which is creating so much. So every third, fourth patient I'm talking to has been laid off. So that creates a lot of stress for the patient. They're very unhappy. Their blood pressure is a little out of control. Um, they're having palpitations. So that's something that I have to discuss and deal with. And I'm actually prescribing some anti-anxiety medications or antidepressant uh, to help them, react to their stress at this point. And, I tell patients that yes, and then even if if they still have the job, they're either working from home that they're not used to, or, they're just stressed out by just not having the social interactions with their families and friends. So there's a lot of different levels of things going on, and definitely it has impacted their heart disease and heart health. And I think by talking to the physician, by talking to us, I'm almost on a daily basis getting blood pressure logs from patients because they want me to make sure that they're okay. Mm-hmm. And, it's a quick glance for me, and then I can always tell them, hey, do this, do that. I'm encouraging them to eat healthy, stick with the heart healthy diet that we discuss extensively, avoid salts. And then, even when they are, although we're saying don't get out of the house, but I'm actually telling them when it's kind of not busy outside, when the streets are empty, please get out, put your mask on, go for a walk, because that releases stress in your mind. It kind of gets some fresh air, and a lot of people have started doing that, and it's helping them and feel a little bit better.
Yeah, awesome. I love your almost holistic approach to taking care of the whole patient there, to keep their heart healthy too.
Yeah.
So sounds like a lot of your patients are probably more vulnerable to coronavirus than the average person. So what are you doing logistically in your practice so that you can keep them safe, but also what are you doing to keep your team safe and yourself safe there in the practice?
So when this thing hit around mid-March, it was very chaotic because, it was a shutdown, shelter, everything. Healthcare facilities were kind of excused from that, but then we didn't have the proper equipment, the personal protective equipment. I'm a private clinic, so, ordering all the gowns, the face masks and all that. So we were able to do that in a timely manner. We quickly incorporated telemedicine. So we do something like FaceTime, which is HIPAA compliant. And then we also do computer visits like we're doing right now, not on Zoom, but HIPAA compliant. And so I try my best to see the patient, because I think just listening to the voice is fine, but if you see a person, they see me, it makes that connection, and they feel like they're talking to a real person rather than a voice on the phone. So we're trying our best. So from mid-March to now, we've switched pretty much 60-70% of the visits to telehealth. We are still doing procedures in the clinic. If somebody needs an echo or stress test or EKG for whatever reason, then they do come in and we give them that service. I have stress tests going on today in my clinic, so we have limited the number of tests per day, so that whenever the patients come, we're not allowing any family members to come during the test days, because they're in here for at least 45 minutes to 2 hours, depending on what test they're having. So, and then we separate them in different rooms. They have to put on, as soon as they arrive, we just laser a temperature beam on them to make sure they're not febrile, and they have to answer a questionnaire about COVID symptoms. We put a mask on them, and then hand sanitizers everywhere in every 12 inches of my clinic. And then, the techs, I have to protect my techs and my nursing MAs and my front desk staff, and everybody has equipment that they wear, and we have masks and things like that, so we do that. As far as patients, like I said, I have a lot of elderly patients. I try to do televisits with them. A lot of our old folks don't have the means or the ability to use computers, or so then I do phone, and then like FaceTime is it's called Doximity, the app that I'm using, which is HIPAA compliant, has really been helpful because it's like FaceTime. So they get a text, and as soon as they click on it, I can see them. So they don't need a computer or a laptop for that. That's been really helpful. But some people just want to see me. And if they insist on coming, then we let them come without family, and they just want to, we make sure they're okay. So yeah, I mean, there are people who just want to come, so we do allow them to come.
Yeah, well, and it sounds like you're taking great care of them. Well, I want to thank you so much for your time. Thank you for answering all these questions. And again, everyone, this is Dr. Farhana Kazi, cardiologist with Affinity Heart Care.
Thank you, Amanda. Thank you for having me.